Okay, so my presentation is about borderline personality disorder. What is borderline personality disorder? It is a mental health condition that affects the way that people feel about themselves and others, making it hard to function in everyday life. It includes patterns of unstable, intense relationships, as well as impulsiveness and an unhealthy way of seeing themselves. People with borderline personality disorder often have a strong feel of abandonment or being left alone. It also leads to impulsiveness and self-injury. So diagnosing borderline personality disorder, as other personality disorders, are diagnosed based on a detailed interview with your doctor or mental health professional, mental health evaluation that may include completing a series of questions, a medical history and exam, and a discussion of your symptoms. Something that is really interesting about borderline is that it's usually made in adults, not children or teenagers, because what appear to be symptoms of borderline personality disorder in children and teenagers will could go away as they become older and more mature, such as like impulsiveness. Some of the symptoms of the borderline, as per the DSM-5, is a pervasive pattern of instability of interpersonal relationships, self-image, and affects, and marks impulsivity by beginning by early adulthood and present in a variety of contexts, as indicated by five or more of the following: frantic efforts to avoid real or imagined abandonment, a pattern of unstable and intense interpersonal relationships, characterized by alternating between the extremes of idealization and devaluation, like holding someone on a pedestal and then immediately being like they're worth, and then something switches and then you're immediately like they're worthless. I don't care about them at all. Identity disturbance, impulsivity in at least two areas that are potentially self-damaging. Examples include spending, sex, substance abuse, reckless driving, binge eating. Reoccurring suicidal behavior, gestures or threats, affective instability due to marked reactivity of mood, chronic feelings of emptiness, inappropriate intense anger or difficulty controlling anger, constant anger or recurrent physical fights, and transcendent stress-related paranoid ideation or severe dissociative symptoms. Excuse me. So the history of borderline, essentially in 1938, Adolf Stern of lists most of the diagnosis criteria and calls the group of people affected the borderline group. And then in 1941, Gregory Zilborg describes the disorder as a mild version of schizophrenia. In 1942, Helene Deutsch defines the type of people dependent on others' personalities as having an as-if personality. And then in the 1940s, Robert Knight introduces ego psychology and describes patients as being in borderline states. Um, Finally, in 1967, Otto Kernberg defines boundaries between psychotic and neurotic and he places borderline personality in the middle of the two. So then moving on to 1968, Roy Grinker does the first research on borderline personality disorder, and then John Gunderson publishes research to help diagnose borderline. Then in the 1980, borderline is included for the first time in the DSM-3. Marcia Linehan introduces dialectical behavioral therapy as an effective treatment. And then the DSM-4 is published, which further defines the symptoms of borderline required for diagnosis. And then finally, in 2008, the U.S. House of Representatives declares May as the National Borderline Personality Disorder Awareness Month. So there are a lot of different treatments for borderline. In my opinion, the best one is dialectical behavioral therapy, which is based on the idea that two important factors contribute to borderline. You're particularly emotionally vulnerable, and you grew up in an environment where those emotions were dismissed by those around you. For example, like you were upset and your parents told you had no right to feel sad, or you're being dramatic. Those two factors essentially cause you to fall into a negative cycle. That being that you experience intense and upsetting emotions, but you feel guilty and worthless for having those emotions. And then because of your upbringing, you feel like those thoughts make you a bad or dramatic person, and then those thoughts lead you to further and more upsetting emotions. And then you have mentalization-based therapy, which is based on the concept that people with borderline have a poor capacity to mentalize, which is the ability to think without thinking. This means like being able to examine your own thoughts and beliefs and assessing whether they're useful, realistic, and based on reality. For example, people with borderline might have the sudden urge to self-harm and then fulfill that urge without questioning it, instead of thinking back and saying like, well, like why am I having this urge? Why am I thinking? That's not a healthy way of thinking. Um, the goal of MBT is to improve your ability to recognize your own and others' mental states, learn to step back from your thoughts and about yourself and others, and examine them to see like, are they valid or are they like where are they coming from? Then you have therapeutic communities, which are structured environments where people take part in therapy. Um, People with a wide range of complex psychological conditions and needs come together to interact and take part in therapy. Most of them are residential, such as large houses where you stay for a couple days a week, and they're democratically run. Then you have art therapies, which include art therapy, dance movement therapy, drama therapy, and music therapy. And they aim to help people who are finding it hard to express their thoughts and feelings verbally and kind of express like how what you're going through art. And then medicine, no medicine has currently been approved to treat borderline. So successes and outcomes, I used this study from Paul H. Soloff. And essentially, the 10-year outcome for patients with borderline personality disorder in diagnostic remission is 85 to 93. However, less than half achieve good social and vocational functioning, and few attain full psychosocial recovery. Um, so people who used self-help measures, about 59.3% of subjects said that those self-help measures were contributing positively to their outcome. And they were described as conscious effort, self-reflection, self-education, physical self-care, and life lessons. Professional help, which includes DBT, CBT, AA, and professional intervention, were used predominantly by people who were of lower socioeconomic status, and they were listed helpful by about 37%, with DBT being the most helpful out of those. And the medication use was spontaneously reported as helpful by 25.3% of the sample and unhelpful by 16.7%. And um, there were multiple medication trials tried during this process. So they really just talked about the medications, the subject's perspective on the medication. And then the book I read was this book called No Bad Parts: Healing Trauma and Restoring Wholeness with the Internal Family Model, by Richard C. Schwartz, PhD. And I thought this book was really interesting because it talked a lot about like accessing yourself and being able to heal and finding like a vision and a purpose and everything, and accepting parts of yourself that maybe you wish would go away, and like being able to approach those aspects without like accepting them, like using radical acceptance. And this is my psychopathology presentation. I'm really excited to talk about borderline in class. We haven't yet, but I'm really looking forward to it because I'm super interested in it, and I think the kind of therapy that I want to do when I grow up, like as a clinical psychologist, is DBT, because I just think it's so interesting, and I love the evidence-based treatments, and I just like I think borderline is such an interesting disorder because it's so hard to live with. Like the instability in relationships and everything. Like my therapist said one time, she was like, the most beautiful part of living is being able to have relationships with people. And I think it's really interesting and really heartbreaking that it's so difficult for these individuals to be able to maintain these interpersonal relationships.